Okay, this is Dr. Erica Michiels. Dr. Michiels is a pediatric emergency room physician at Helen DeVos Children's Hospital, and she has kindly joined us today to talk about a topic that we have all been hearing a lot about. So if you wouldn't mind, we're going to go through, address a couple things. If you wouldn't mind utilizing the chat for your questions, and then I'll read them to Dr. Michiels. But the first thing we want to do, Dr. Michiels, is talk about RSV. What is that? Let's talk about it and go from there.
For sure. So RSV is a virus, and in older children and adults, when you have RSV, you feel like you have a cold, and it spreads like a cold, and it's very active in our community right now. It's active nationwide. Unfortunately, RSV is very hard on young babies. So especially for kids age 2 and younger, when they get RSV, there is a risk that they will develop some significant difficulty breathing and need to come to the hospital. The good news is that most kids who get RSV do just fine, even the little babies. But because there is that increased risk to the younger kids, we see a massive uptick in the visits to the emergency department, visits to pediatricians' offices, as well as hospitalizations in that age group.
Thank you, Dr. Michiels. So tell us, when is it appropriate to visit your pediatrician? And then when should parents seek care in the emergency department?
Yeah, I think we have a lot of parents in the state right now who are sitting with their very sick children in the middle of the night trying to decide, what do I do? Because this doesn't seem normal. And if you believe that your child or your baby is struggling to breathe, if you think that they are in distress, then the emergency department is the right place for you. And we welcome you to come on in and get looked at. But if you have questions about fever management, if you think your child may have an ear infection, if their runny nose and cough just seems to be lasting longer than you expected, those are the kids who are certainly able to be seen in their primary care doctor's offices. They're able to be seen at urgent care centers, and you have time to give your doctor a call and get advice for what your best next step should be.
And if someone should be admitted to Helen DeVos Children's Hospital, walk us through how that might look a little bit different.
Yeah, so this is not a Grand Rapids problem. It's not a state of Michigan problem. This is really a nationwide problem. And so when you come and visit us, your care may look a little different than it has in the past. Firstly, the emergency department is incredibly busy, and they're busy all across the state. For example, we usually see on average around 145 kids a day in the emergency department, and we're currently averaging over 225 kids a day. So that means that you're very likely going to have a wait unless your child is the sickest of children who is brought in. You may receive your care in the hallway, in a bed, or in a chair. And the whole department is just going to feel very busy. But I want to reassure everyone, it feels busy, but it's very controlled. The emergency department staff is accustomed to dealing with surges, and we will take care of all of you. It just might take a little longer than it has in the past. And it's important to remember that you might not be seen in the order that you arrive. We are seeing the sickest children first, and then moving our way through everyone else to get to all the people who check in. And we're doing things as fast as we can, but we are seeing a lot more kids, and so you may wait longer than you're accustomed to. For kids who need to be admitted to the hospital, our hospital is really full. For example, we generally have about 24 intensive care unit beds, and we currently have 42 intensive care unit patients. So it takes longer to find a place for kids to be in the hospital. We want to rest assured we will find a place for your child if they need to be hospitalized, but it may take a little longer, and you might have a roommate. Historically at the Children's Hospital, we have not placed 2 or more kids in the same room. We've had all private rooms. But in order to take care of as many kids as we possibly can, we're doubling up a lot of spaces.
Thank you, Dr. Michaels. Let's see, we've got a couple questions in the chat.
Mhm.
Number one, is it true that adults can get RSV? If so, can this be spread to your child or from your child to you? Are there different symptoms for adults?
Yeah, that's a great question. So anybody in the world can get RSV. And when adults get RSV, in general, it feels just like having a cold. And just like families pass any other cold from child to adult or from adult to child, that happens with RSV as well. In the adult population, RSV really isn't dangerous except for our most vulnerable elderly adults. RSV is nowhere near the same as, let's say, COVID for an adult. The symptoms tend to be incredibly mild for adults who catch it.
A follow-up question to that from DPM. Last week we learned that cases of RSV are up 365%. What is the percentage of increase since last week? I don't know if you know that off the top of your head, but we can get that number.
Yeah, I don't know that number. I can tell you that, for example, we currently have about 60 kids inpatient with RSV at the Children's Hospital right now. And 2 weeks ago, we only had 15. So when viruses hit communities, they tend to do it in a sort of surge-like fashion. And so we don't know where the peak is for this RSV season, but we have been on almost a vertical uprise for the last several weeks.
Another question, is the increase in the number of kids in the ER directly attributed to RSV? Also, when did this surge begin?
So we're seeing all the kids who we always see in the emergency department, kids who have broken arms, kids who have tummy aches, and everything in between. But what makes the ER so busy right now is that the RSV surge is hitting and is climbing at a rapid rate. So we're seeing all the kids we always see, and then we have this extra population on top of that who have RSV, babies who are experiencing difficulty breathing and fever, and that just makes everything busier. I would say that we started to see RSV kind of trickle in about 4 weeks ago, but we really knew we were there about 2 weeks ago.
Can you describe the symptoms that would require a parent to bring their child to the emergency room?
Mm-hmm. So the vast majority of kids with RSV are going to look like they have a bad cold and are going to do fantastic at home with good everyday at-home care. What we want you to watch for, and what children get hospitalized for with RSV, is their feeding. So we need babies to be able to feed well enough to make wet diapers. Their work of breathing. So I always tell parents, pull your baby's onesies up and take a look at their belly and their chest. If their breathing seems really fast, once a second or faster, or you're seeing that they're tugging in under their ribs and that their belly's really moving hard with every breath, that's a kid who really needs to be evaluated. And then we also see kids with this need oxygen. So if your baby's color is looking blue, they're working hard to breathe, those are kids who should come to the emergency department right away.
Another question from MLive. We heard about a 6-year-old in Macomb County who died recently of RSV. I assume that's very uncommon.
That is a very uncommon age to see a death from RSV. And of course, I don't know the details of the case, but any viral infection is more difficult on children who may have pre-existing medical problems. We also can see some complications like pneumonia, and it can also trigger asthma in older kids. So just like any other virus, there are always going to be these very tragic extreme cases. But generally speaking, RSV is going to be hardest on kids who are age 2 and younger.
You mentioned that HDVCH is doubling up on its ICU beds. Can you talk about what else is being done to prepare for a potential increase in RSV cases?
So I want to be clear, we are not generally doubling up in the ICU. We have a little bit. We're mostly just expanding into other places. We are doubling up on our general medical floors and for our surgical patients aggressively to make room for everybody else. I want to assure our community that from the president of the hospital to the men and women who clean your rooms, our entire system is working to make space for as many kids as we can. We are on daily calls with leaders from all over the state to talk about bed space that's available in any child hospital across the state. So we are really working to acknowledge this is not business as usual, and we need to collaborate all across the state with all of the children's hospitals and really try to make some creative solutions that we can act immediately, not dissimilar to what we did with adults during COVID.
Thank you for that reassurance. Is this early for normal RSV season? What does that mean for the rest of the winter?
Well, that's the million-dollar question. So the COVID cycle really changed when viruses are hitting in our community. All of us were separate for a long period of time. People masked for a prolonged period of time. And then when the masks came off, all of these respiratory viruses surged again. And of course, that's going to be hardest in our youngest kids. So RSV usually hit around Christmas. And so our worst time for RSV tended to be December, January. We saw a very early RSV peak last year where it really peaked in August and September, and it's again early this year. RSV will surge and will peak and will go away. What we are worried about is what's going to come after that with the influenza season this year. When will influenza hit and how bad of a season will it be? We're really, really hoping that our RSV surge has settled out before we start to see a surge from influenza. And I think that's going to really affect what the rest of the winter looks like at children's hospitals across the state of Michigan and really across the nation.
You may not know the answer to this question. How many of your patients are from farther away than the Grand Rapids metro area?
It's a great question. We always see patients from a large region at the Helen DeVos Children's Hospital because we are a quaternary care children's hospital that accepts transfers from all over the state as routine. In the emergency department, we are seeing a much higher percentage of just our local population. But as you move into the hospital, we do accept transfers from all over Michigan. We don't tend to see a lot of kids from the east side of the state because there are large, well-equipped medical institutions on the east side of the state who generally take care of their population. But we always see kids from the UP, we always see kids from the upper mitten who need specialized pediatric care. Current state, because there's a statewide bed shortage, as I described, we are working at the highest levels across every children's hospital in a coordinated fashion to try to identify every day who has beds for the sickest kids in Michigan and where can we direct those kids to get the safest care.
Thank you for that. How long does an RSV surge usually last?
We usually see a 6 to 8 week cycle that is the worst period of time. And of course, there's a lead into that, and there's kind of a decrescendo afterwards. But usually 6 to 8 weeks is really the duration of the peak period of busyness. And I don't necessarily expect this to be any different than that. It's just that this surge seems to be more serious. The kids seem to be sicker, and we're seeing more of them than we typically would during a standard yearly RSV surge.
What should parents be doing to prevent RSV?
It's tough. It's very contagious, just like any other cold. So just like we saw with COVID, the only way to truly prevent it is to fairly isolate yourself, which is difficult for families to do. Parents need to work, children need to go to school. Remember, this is something that a second grader can catch at school and then bring home, and then it's the baby at home that is the child who actually gets the sickest from the illness. So I would say common sense rules the day on this. If your child is coughing and has a runny nose, please don't take them to the birthday party. Please stay home from church that day. Keep them out of school and keep them out of daycare, because your child is infectious and very likely to spread this to other families. So I think the best advice is, if your child is sick, please keep them home until they're better. But we understand parents need to work, kids need to go to school. And so there's no perfect way to isolate yourself from this virus.
Are there any other questions from the media? Give them a minute. Dr. Michiels, is there anything else that you would like to restate or add?
Yeah, I think it's just important for our community, and really every community, to remember we're busy, but we are here for you. We are your children's hospital. We are your resource. And if you think your child needs to come to the emergency department, we will see you. We will find a way to see you. It may look different, but that's okay. We will still see you, and we'll still take care of you. We are still the community resource for Grand Rapids. And if you think you need us, we're here for you.
Great, thank you for that reassurance. I don't see any other questions, unless anybody else, last minute questions? I think we're good. Thank you so much, Dr. Michiels, for your help, and thank you for being there for our kids, and thanks for taking the time to do this. I know how busy you are.
Absolutely. I'm really grateful for the opportunity. I hope that we can reassure some families out there.
And thank you for your media friends for helping to get that message out for us. Have a great day. Let me know if you guys have any follow-up questions.